Barry Chaffin from Nova Analytical Labs in the wonderful green state of Maine. Thank you for being here today to talk about some things that's going on up there. You know, it's really neat. You go back a few years ago, even just within the last 5 years, when people thought of legal cannabis, they mostly thought of the West Coast. They thought of, Washington, Oregon, California, Nevada, Colorado. But now, when you look at a map that's legalized, when you see it, the majority of the East Coast has some form of legal marijuana, whether it's medical, recreational, or both, or just at least decriminalized. And so I love seeing that. I love seeing the advances that we, especially with, the East Coast being the primary, the place of all of our political. And I mean, that's another argument and a conversation on its own with the decriminalization in DC and their approach to cannabis in DC and not pushing it onto the federal level. But there's something else going on in Maine, something that got sent to me today. And I can see why this is near and dear to you guys that you want to talk about. So first, let's talk about what Nova Analytical Labs is. You were the co-founder and you're the COO of Nova Analytical Labs. So tell us a little bit about how it started, about how you got into the space.
I've been in analytical testing for most of my career. I started off in environmental testing. Shortly after that, was involved in pharmaceutical testing, doing phase 2 clinical trials, then moved into toxicology, clinical toxicology testing. Actually, from that, actually owned and operated my own clinical toxicology laboratory. Through the analytical, testing environment, from since college, right? So,
and the life cycle as it was.
Yeah, exactly. So lots of experience in analytical chemistry. And with that, always been a cannabis enthusiast, right?
Okay.
I don't want to say, I don't want to date myself here, but from a very young age, like a lot of folks, I tried growing pot in my dorm room closet. Like a lot, so you tried that, you quickly discover you can't do that, and stay in school at the same time. After that, tried my hand at it. I'm just not a gardener. I'm not good at it. Don't have a green thumb, but I am a damn good analytical chemist, right? So we started seeing a lot of this legalization occur. Like you said, started mostly on the West Coast. Now it's kind of becoming more and more national. And there was a need, right? A need for testing services. So I saw the need. I had the skill set, and I had the passion. So it was a good fit. That's me personally. How Nova started was two like-minded individuals, Greg Newland and Chris Altamari, my partners. I've known Greg for decades. We kind of came up together through the clinical toxicology space. We were having a conversation one day. I owned my own lab. He owned his own lab, clinical toxicology labs. And we were just talking about, the need for a good cannabis testing lab in the space. At the time, a lot of labs were started, no offense to the real estate moguls, but a lot of labs in the early days were started by people who were in real estate, right? They had the money, they had the space. Like, I'm going to hire a chemist fresh out of school, and he's going to start this lab for me, and we're going to be great. Fortunately, a lot of, it doesn't work out that way. It's not that easy. These guys fresh out of school don't have a whole lot of experience, and the owners of the lab in real estate don't have a whole lot of scientific experience. So, Greg and I were having the conversation. He was doing some consulting for cannabis labs. And, it just seemed like the right thing to do. It was a fit. We both had the passion for analytical chemistry. We both had a passion for cannabis. It was something that not only filled the need for the community, but a personal need for both of us as well. There was that old saying, do what you love.
Mm-hmm.
It was no brainer. So we both divested from our toxicology labs. Greg knew Chris from his consulting. The three of us just kind of talked about it, put together a plan, and it just worked. It just fit. Made sense.
Was Maine because that's your home state, or was that?
No, actually Maine's not none of our home states. I'm actually in Austin, Texas.
Greg, okay.
Greg and Chris are Pennsylvania. We scouted every state, trying to find where we should start, because our goal was to have not just one lab. We wanted to have multiple labs in multiple states. We wanted to kind of make Nova this brand and the symbol for integrity and accuracy. We looked a lot of different places, and we settled on Maine because it was a new market at the time. No labs there. It was going to fill a need for everybody.
Mm-hmm. Mm-hmm.
We had some connections in Portland. talked to everybody, just seemed like a good fit. We started a lab there. We ended up actually, another lab actually beat us to the punch. We were actually the second lab in Maine, but it still worked out great.
Nice. So let's get into a little bit some of the issues. So let's timeline it really quick. When did cannabis go legal in Maine?
So it's been legal for quite some time, I think before 2016 for medical, but I think the adult use passed, the voters passed it, I believe in 2018, the governor vetoed it, a new governor came in. I think, long story short, it went live in 2020, the AU program. Adult use went live in 2020.
Okay.
But there's a lot of history before that kind of leads to the, the environment in Maine right now around cannabis.
What is that environment?
There's a medical program and there's an AU program, right? The AU program, the adult use program, the recreational, is very, very regulated. It's track and trace. There's mandatory testing, all that, standard regulations you see from state to state. Yeah. The medical industry is essentially unregulated. Been that way since its inception, right? It was the first one. It was one of the, may have been earlier than California, actually. Don't quote me on that. I need to verify that timeline. Yeah, it had been in existence for quite some time, operating unregulated, and there was a lot of pushback from the medical community to put any kind of regulations on the medical program.
Yeah.
So that has carried through to today. Today, still, the AU program is very regulated, very regimented, track and trace, mandatory testing, and the medical program is still essentially non-regulated. No track and trace, no mandatory testing. Pretty, just Wild West or Lime.
That was going on that was almost everywhere for a while. I mean, I remember in the early days of Colorado, you would go into dispensaries when the early days of rec, and they would have the rec side and the medical side. And the product offerings were different. The dosages were definitely different, and the limitations were different. And then that sense is all changed now. I mean, going to pretty much any dispensary into Colorado or even here in Nevada, and the medical and recreational now is just basically a different price. It's different price and it's different daily limit. You can get more if you have a medical card, and you get to pay less. But the products are the exact same. It all is the same testing, and it's all the same regulations and stuff. So that's sad because, I mean, in a medical market, if anything, that needs to go through even more rigorous testing, because those people that are using it, some of those people might have some really serious ailments. I mean, God forbid they have any ability to fight infections, or, if they have any other, if they're just sensitive to different toxins or different just pollutants coming in. And, there's those people that have really bad allergens that can't ever leave their house. And if they leave their house, they have bad breakouts and everything. If they're using cannabis and that cannabis isn't clean and it's coming into them with all these different pollutants, what's that going to do to them?
Yeah.
And that kind of leads me into I think the thing that you guys wanted to talk about today, which I'm glad to talk about. Regulation is something that is near and dear to my heart, because I believe that through regulation, that's how we can have a better future for the space. I do believe in the right kind of regulation, though. I don't believe in the politicians being able to regulate everything. I think they need to come to people that have been in the space for years. They need to take all aspects. They need doctors, they need lawyers, they need chemists, they need the farmers. They need everybody to come together and be able to give a good, honest opinion and help them, really to just help them write the bills and write the laws, and not have the politicians in charge of it, because we've already seen it in a lot of different states when people that don't know the space get to write the regulations that run the space. We end up with a lot of headaches and a lot of things that just don't make sense, like we're seeing there in Maine. So the article I'm referring to, it came over. This is from you guys. This is from Nova Analytical Labs. It was posted on September 19th, 2023. Talks about it says 17% failure rate discrepancy revealed between state required adult use samples and voluntary medical samples submitted. You highlight the risks of lack of mandatory medical cannabis testing. As I started reading through this article, there's some pretty scary numbers in here. Samples that, so in Nova's analysis of 3,200 adult use compliant samples and 1,400 voluntary medical samples between March 2022 and June 2023, a failure rate of 3.82% in adult use samples and that 20.73% failure rate in voluntary medical samples was observed. And then it goes into the pesticides. I'm going to let you name off the pesticides because you're a chemist and I'm not. And I would sound crazy if I started to, but as a user, anytime I'm like, drinking anything or eating anything, if I'm reading the label, I'm one of those people, if I'm reading the label and I can't understand what's in it, I don't use it. I don't want to put that in my body. And as I'm reading these things, this is definitely not anything that I want in my body. I don't want to be inhaling this. I don't want to be eating this, absorbing this. So I'm going to open up the floor to you, man. It sounds like there's some problems in the quality of the product and the medicine out in Maine.
Well, yeah, we did this study based off of, like you said, voluntary medical testing, right? So these are from our clients that are in the medical field who are testing voluntarily because they want to make sure that their product is clean. That says that 21% of those are failing. So, what about the guys who are knowingly using pesticides in their product, right? So that failure rate in reality is probably, much higher.
Well, exponentially.
Yeah. But to me, this, highlights the need for some sort of regulation in the medical field, right? When you have a regulated industry that's only producing, 3.8% failure rate, and this is just pesticides we're talking about. This isn't, microbials or heavy metals or residual salt contaminants. This is strictly looking at the pesticides that we test for. 1 in 5 products off the shelf in the state of Maine, by these numbers are going to be contaminated with pesticides.
That's scary, man.
Yeah. Yeah. And, a lot of it is not purposeful use of pesticides. The pesticides are tricky, man. They're everywhere. If you gotta grow next to somebody else who's using pesticides, a lot of that's going to get into your product. It's
contamination.
Yeah. It's not that people are knowingly going out there because that's a lot of excuse from our potential customers. Like, well, I don't use pesticides, so I don't need the test. It's like, true. You feel that you're not using pesticides so that, your product's going to be clean. But what about the guy next to you or the guy, who's 3 acres down, he was just spraying the hell out of his product and it's coming over.
Yeah.
That stuff just finds a way of getting in. And, it's a good, roadblock. It's a good safety hurdle that I feel that, consumers have the right to be protected, right? They have the right to kind of go into a shop and just have that feeling of, no matter what I'm looking at here, it's going to be quote unquote clean. I don't have to do my research. I don't have to dig into it. And there's going to be those that will, right? As with everything, like you're kind of like me, before I purchase anything, right? And I find out what's in it. But not everybody's that way. That's time consuming. You know that, right? I mean,
yeah, it is.
It makes grocery shopping very difficult. The grocery store, or whatever, cosmetic products, or whatever you're going to put in and on your body, to go through and research every single product yourself is very, very time consuming, and not everyone has that time or ability to do that. So I think as an industry, we have a responsibility, to do that for the consumer.
Agreed. Especially like you're saying on the medical side of things, people are supposed to be able to trust anything that's medical use, right? When you go into a doctor's office, you're trusting that it's sanitary. You're trusting that they wash their hands and they're putting the gloves on or something, when they're dealing with you. When you're trusting that the medication that they're giving you is correct. I mean, that's also why people do turn to alternative medication, though, is because they want to get away from some of the side effects. And so they want the natural medicine. But man, if we're giving them natural medicine that still has these other substances, I'll just call it that, because like you said, it could be pesticides, it could be mycotoxins, it could be mold, it could be heavy metals, it could be any sort of foreign substance that's not supposed to be there. Now, when they're taking that, oh my goodness, like now they can't trust that side either. And that's something that we have to be able to do. It scares me. I wonder. So when you guys were testing a lot of this, what was the product types that were you testing? Was it a wide variety from like flour, edibles, topicals, tinctures, like concentrates, or was it more just dialed in towards like the flour, or what was this that you guys were testing mostly?
Oh, this is everything. This is everything. Yeah.
See, that's where that scares me, is because when you get into concentrates, I have a lot of familiarity with that side of things, my day job with running a brand and stuff on the hemp side of things. When you're doing concentrates with all the caustic, we'll just say the caustic chemicals and astringents that you use to be able to strip the plant material down, to be able to isolate the cannabinoids and stuff, if not properly done, and if not properly purged and cleaned off, can be very toxic. And we've already seen that. And we saw that scare back in 2015, 2016 on the West Coast. And, that thankfully has died down, but there's still a lot of irresponsible people out there doing unsafe practices that can potentially harm people. Because when you inhale something, that's the quickest way for absorption, pretty much, and besides injecting it into your bloodstream. And so you got to be really careful. Some molds, good grief, I could only imagine someone that has an autoimmune disease and they inhale something with a mold. Oh my goodness, like just the amount of damage that could cause.
Absolutely. You hit on it earlier about regulations not being done by just politicians. One part of that is politicians are inherently distrustful, right? People just don't trust politicians in general.
Yeah.
Right? So anything that comes out in regs that are written by politicians only, there's gonna be distrust, right? So I agree. You have to have a whole community that gets together to kind of set these rules and regulations. I guess where I'm going with that is, you mentioned concentrates. No state has. I don't think they have the regs 100% right. I don't think there's a single state out there that's just got it, in my opinion, just dialed in. One example in Maine, concentrates don't have to be tested for pesticides in the AU program if the flower was tested, right? And anyone who's ever, done extractions or concentrates knows that by definition, you're concentrating. So if the flower passes for pesticides, let's say there's a little hit there, but it passes the limit and this flower's clean, they concentrate it. We've seen this in our lab. You've now created a product that's contaminated.
Yes, I've seen it happen too. Yep.
It's just, there's problems like that in every single state, in every single type of reg. There's like I say, no one's got it right. And it kind of goes back to what you were saying earlier. We need a coalition of folks to get together and come up with common sense regulations that just makes sense all around.
Yeah. Now, is that something, you said you guys are trying to get multiple labs across the country and trying to create a network. So do you have any more than just in Maine? And have you guys been able to create that network?
Well, we just partnered with a lab out of Florida called Certified Testing and Data, just to open a lab in New York, in Albany. So we're very excited about that. We just started that process. Hope we'll have that lab open by the end of the year, if not sooner. But that will be our first laboratory outside of Maine that we're involved in.
Right on. I love it. Have you guys ever worked with ACS Labs down in Florida?
We have it. We don't personally work in Florida as our partner that we just partnered with, the Certified Testing. We have a lab in, and I'm not 100% sure who they've rubbed elbows with down there.
Nice. No, ACS, Roger Brown, founder, CEO. He was on one of my earlier.
Yeah.
They're a really good testing facility. We've had some of our products tested through them. They've been instrumental in helping in the hemp industry with just the massive amount of products that are in the hemp industry and, just the overspread of how they're all over the United States. There's a lot of bad apples, but ACS has been able to maintain the pinnacle of excellence, at least for the hemp products, and giving a certificate of authenticity and, actual true COAs. They've made companies mad before. They've turned away business before and stuff, but they've made a name for themselves. And so we need more people like that, people like yourselves that are true to what they do and not just there to make the money. Because at the end of the day, you give bad results, you give non-passing results to a client, they're not happy with you. They might go somewhere else. They might try to get it because they want those passing results, So it's, it comes down to where you said with people in the beginning that weren't in this space for the right reasons, and they were in it just, oh, I see a need, let's go, I have the money, let's buy the property, let's build a building, let's hire a chemist, and let's just make some money. Those are the type of labs that are always going to be passing COAs. We refer to it as COA shopping, where, you have your product and you send it out to as many labs, and when you get the one that you need to see to post, all right, we're clean, we're good, this is the one we're going to roll with.
Yeah. We call it lab shopping, but yeah.
Yep. Like, same thing, same exact thing, and that's one of the things that's got to be fixed.
Yeah, absolutely. That's that's one of my biggest priorities. In the industry as well as in Maine is lab shopping. I think when people ask, what's the biggest problem I see from my perspective, one would be non-regulation, and two would be lab shopping. I think there really has to be a crackdown on laboratories. I think the labs should be the most scrutinized part of this industry. It's, we're kind of we're the gatekeepers, I guess, for lack of better term. We're the guys who say this is good to go, right?
Yes.
I used to say in the beginning that I feel that the lab industry is what's going to legitimize the cannabis industry, right? By showing that this product is clean and safe. Because there's still a lot of folks out there, less and less every day, but there's still a lot of folks out there who feel like, cannabis it's the devil, it's evil. Yeah. Can't consume that stuff. And
reefer madness, it's still alive and well.
Exactly. It is. I feel like, our part of this from a lab standpoint is showing people, look, this is safe. This is clean, contaminant free, to the best of our ability. And, for, lack of a better term, it feels like that the labs will kind of legitimize this. And, maybe one day we won't be needed, but I feel like, at this point we are. Lab shopping it is a real thing. It's a big problem in our industry. I think you got to come into this thing with the right reasons. You have to be here with integrity, and you have to be here with accuracy. We're coming from the clinical space. Number one mantra is, you had to be 100% correct 100% of the time, because whatever result you put out to a physician was going to be how he treated his patient, right? That was going to determine how that patient got their care. So we kind of take that same philosophy to cannabis, right? It's not a flower, it's not an oil, it's not an edible coming into our laboratory. We look at that as a patient, right? Because whatever we say is in that product is going to directly affect the consumer, right? It's going to affect the public health at large. So we have to treat it like that. It can't just be a product. We have to look at it like a patient. So yes, accuracy and integrity are key in this lab space, I feel. Greg and Chris and I are always talking like, if we haven't pissed some people off, we're not doing our job. That's right. If everybody coming to our lab is happy 100% of the time, then we're not doing our job right. Because people are going to fail, and it sucks to tell them that. It sucks to tell them that their products have some contaminants in it. They're not going to be able to sell it. But, that's just part of the job.
Mm-hmm. No, I thank you for that. That's what we need. I hope that the labs never go away. You guys are the gatekeepers. We need safe products. I never want it to turn into where it's just such a commercial product that now it's treated like tobacco or alcohol. I don't ever want that, because it's not. I never want it to be used the same way. That's my advocacy. I never want it to be treated like alcohol or tobacco and regulated like that, because it's a completely different product. Alcohol and tobacco don't heal. Cannabis does.
Yeah. And that, I agree 100%. My dad was on, he had a terrible back injury, and, he was on fentanyl, oxycodone. It was just, the side effects were just killing him. But, cannabis got him off. He doesn't take opioids anymore. He just uses cannabis. And luckily, Texas finally passed, because we live here in Texas, finally passed some minimal medical cannabis.
Mm-hmm. Their compassionate care.
Yeah. So,
but even then, it's really Texas is a horrible program. So restrictive. That's
a whole new episode.
That is. Yeah. That's a whole nother episode. So there's a lot of people that don't realize that you tell them like Texas, and they're like, wait, I thought that was like, you get in a lot of trouble. It's like, yeah, you do still get in a lot of trouble for cannabis, but if you have your medical card, then, you can get out of that, but it's still very, very, very limited. And
yeah. And in that, there's no testing. Like Texas allows the few medical producers that it does have, they essentially do their own testing, and really all they test for is potency. That's it.
Yeah, no, you can't self-regulate like that. I want to kind of switch topics here for the end of our talk. The Safer Banking Act is coming out.
Ooh.
And I'm sure, everybody in the cannabis industry is tracking that. So I kind of want to get your feeling as an analytical lab on that. And how does that affect you guys? What are you looking for in that?
I kind of look at it and, in a kind of a pessimistic light, because we've seen this come through before multiple times and it never goes, never. So I'm not, to be honest with you, I've just stopped following it. I've stopped reading what's going through now because it never seems to pass. The day that it passes is the day I'll actually get into it again. And again, that's just my pessimistic attitude. It's just one of those things where I'll believe it when I see it.
Got you. Well, I'm hopeful for it. I agree, though. We've seen it come through several times. I'm hopeful for it this time. It seems to have a little bit more traction. I'm interested. I was seeing some of the sponsors on it. I'm from Wyoming. That's the state that I claim. I live there the most, and that's where I've started companies and stuff out of. And Wyoming for years, has been very, very anti-cannabis. But that's on the political side. Now, the general population, they want it. They support it. They're always driving down over the border, either to Colorado or up to Montana, depending on which side they live on, and they're purchasing it. There's actually a lawsuit going on in Wyoming right now. The Normal organization is heading it up to sue the state because I think it was like triple the amount of signatures that were needed for the petition. And they denied them. And they said that they weren't registered, even though they were all registered voters and they had all the proof and everything. So there's a lawsuit going on against the state right now. For the first time ever, the Cheyenne City Council, which is the capital, the Cheyenne City Council has proposed a decriminalization of marijuana and medical marijuana for the state. So there's some things happening. And the senator, a Republican senator, Senator Loomis, she's one of the main sponsors of the Safer Banking Act. So it's neat to see some of the people that you least expect and some of the states that you didn't expect actually pushing forward in this for advancement of access to marijuana. So,
yeah, people can't surprise you. Like we talked about earlier, politicians, man.
All right, they're going to do what's right for them at the time. Well, thank you guys for what you're doing over at Nova. I truly am thankful for good labs that have no problem telling someone when something isn't right, and telling someone when their product is going to fail and that they need to go back and do it again. That way, like you said, the patients can trust us when they come into the shops and purchase the products.
Absolutely. That's what we strive for. That's what we're here for. And, we go a step further. If we have to tell somebody their product fails, we have services where we come out, we do environmental swabbing, we test water, we test your soil. Like we're here to be partners with our clients. Everybody that way. It's like, look, if you're failing for something, let us come out. Let us come and see if we can trace where this source of contamination is. And then you can fix it. And then you can go forward passing. You go forward with clean product instead of just going to the lab down the street so you can get a passing result. That's just not the way to go.
Not like you said, it's not always the pest. It's not them. They're not always using pesticides. Maybe it's in their water lines. They didn't clean out their water lines, their irrigation lines, and now they got mold or something. Maybe it's in their trays or their dirt or many different things that
we've factored down to HVAC ducts. I mean, it can come from anywhere. Contaminants can come from anywhere. And it's kind of our philosophy to help you figure that out. And now
you guys are more than just a testing facility. Then if we're expanding on that, you guys are a regulatory board, a compliance board for the space as well. It sounds like the grow ops and the cleanliness of the space and stuff, you guys are helping.
Yeah. That's certainly a service we provide. Again, we want everyone to succeed in this.
Well, I hope you guys get active in some of the regulation and stuff that comes up, because you got some very good ideas and forward thinking, and you understand the practices that need to be in place and the checkpoints that need to be gone through to create a safe, reliable, consistent product. So,
yeah, absolutely. And we do. We participate a lot, and the governing body in Maine, the OCP, they're very receptive to our feedback and our input, and we give it. They probably get tired of hearing from me, but we certainly do give it.
Well, I've seen the most change happen in regulation when people like yourself get involved. I have some friends that own a lab in a manufacturing lab in Florida. I'm also friends with Roger Brown. In Florida, when they beat the recent bill that would have banned hemp products, like would have killed the hemp industry in Florida, it was the industry professionals, lab technicians, scientists, chemists, that came forward and gave their testimonies. Some people out of pocket. I mean, you probably understand this. Toxicology reports are insanely expensive. Those studies are insanely expensive. And Arvida Labs, out of their own pocket, has done 2 toxicology tests on 2 separate cannabinoids. And they were able to present those findings and everything. And so because they were professionals in the space and they came at it from a different light, they were able to help and get some really progressive bills passed and save the hemp space in Florida. So thank you for having that voice.
Yeah. Well, we tried.
Oh, man. Well, have a great day today, bro. I'm sure you got lots of stuff to get to. Thank you for just giving us some time today to talk about what Nova's doing and the excellence that you guys are creating up in Maine. And best of luck to you out in Texas as well, and the new ventures that you guys got going on with the new lab coming up in New York. So wish you guys the best of luck.
Awesome. Thanks, man. You too. I appreciate you having us on.